Hi, Dr. Jermel. I'm Dr. Trevellyan. It's nice to meet you.
Nice to meet you too. Thank you so much for coming.
Well, thank you so much for having me. First off, I just wanted to congratulate you on your recent appearance in the Syracuse Women magazine. That's really awesome.
Oh, thank you so much.
You're welcome.
Sweet of you. All right, well, I have a couple questions for you, as you may know, so I'll just get started with those. First of all, tell me about yourself.
Well, I'm a recent graduate of the Ithaca College Physical Therapy program. I have my doctorate in physical therapy. Through the Ithaca College program, I've had experience on various outpatient, not various outpatient clinicals, but various clinical experiences, one of them including outpatient, as well as inpatient subacute rehab. And I'm still working on getting more experience in the neurological rehabilitation field, but I'm hoping that as my career progresses, I'll be getting there. What really interested me about this was that I'm just really interested in helping patients be as functionally able in their lives as possible. Like, I really just need them, I don't need them, they need to, and I want them to be as proficient in their own activities as they can be.
That's awesome. It's good to hear. Tell me a little bit about your strengths and weaknesses.
Well, as far as my strengths go, I'm very hardworking and I'm very motivated to finding the answers to problems. So if I come across a problem in the clinic that I can't come up with an answer for immediately, or if a patient or a patient family has a question that they would like me to answer, there's a good chance that I will work relentlessly on that problem until I get them an answer. Whether that means talking to other staff around me or doing research on my own outside of work hours, like, I will get them the answer that will help me provide the best care possible for them. Another strength of mine is punctuality. I'm a very big proponent about being early and even just on time to patients. I feel like that's a big part of the profession that shows that you really respect your employees and your patients and your patient families. As far as my weaknesses go, occasionally I can come off as shy or very quiet when you initially meet me, but that's not to say that that's showing a lack of confidence in any way. I'm very confident in my abilities and my skills, and I really think that, excuse me.
You're fine.
I really think that once you get past that initial quietness that I tend to put off, I really do thrive on working with patients one-on-one and working with patient families and the people around me.
That's very important. Glad to hear it. What interests you about this job?
About this job in particular, I'm really interested in the work that you do with patients with balance problems and the falls prevention program that you do. I did have some experience with that on a couple of my clinicals, so I've just been really interested in that, as well as watching, the people around me get older and have some of these problems. Like, it's just been an area that I've wanted to get into for a long time. Another thing that I'm really interested in that you do in particular is your amputee rehabilitation. I saw some of that on one of my clinicals very briefly, but it's just really interesting to see the different demeanors of the people that you work with and how they can take their disability in stride with the progress that they are making in life.
Huh. Very poetic of you. What experiences have you had that have prepared you for this job?
Well, like I said, in one of my clinicals, it was an outpatient orthopedic clinic, so I got to work a lot with elderly patients who need balance training and falls prevention training and such like that. With these patients, we worked a lot with lower extremity strengthening and core strengthening, as well as different types of balance and falls prevention works, like stepping on foam, different surfaces, stepping over hurdles, stuff like that. I also had, like I said before, a brief experience with a patient who had bilateral lower extremity prosthetics. So just meeting her and really getting to know her story and what was going on and how driven she was to, get back out there and get back into life as she was before she had the surgery. It was just really, really interesting and motivating to see that person in their life, and it just makes you really appreciate what you have and how much you can do to help that person.
Yeah, that was great. Where do you see yourself in 3 and 5 years?
Well, hopefully I'll still be working with this company. I really do think it would be a great fit for us. If I haven't already obtained my NCS, I would love to be working on that, as well as continuing my education in the amputee rehabilitation. Like I said, I'm very interested in that field. I just haven't had as much experience as I could. I would also love to be doing continuing ed in the balance and falls prevention program that you do. I think that's really where I'd like to focus my time. Obviously, I'm open to any sort of area that you guys treat, but that's mainly what I'd like to be doing in 3 to 5 years, is just continuing my education and learning as much as possible to be able to provide the best care that I can for my patients and my patient families.
That's great. Well, that's all I have for you. Do you have any questions for us?
I just had a couple questions, mainly considering your continuing education opportunities. I would really love to do some continuing education in the vestibular aspect of neurological rehabilitation, because I know that sometimes comes along with brain injuries and head injuries and such like that. So I'd love to know if that's anything that you offered, or if that's something that I could integrate into my hopeful career with your facility.
Yeah, that's a great question, and I can assure you that we will get you that information in just a little while. But that's all I have for you. So, any other questions?
Could you guys have a business card that I could take with
Yes,
me?
I have it right here, and I can give that to you on your way out.
Right, thank you so much.
Yeah, thank you.
It was wonderful to meet you.